Hello and welcome to Filling the Sink, a podcast from Catalan News. My name is Lea Beliaeva, and today we're talking about breast cancer. October 19th is the World Health Organization's International Day Against Breast Cancer. In 2022, more than 2 million people worldwide were diagnosed with the illness, with the number of diagnoses here in Catalonia last year being around 5,400. On today's episode, which also happens to be the number 200, we will discuss the importance of early detection, hear from survivors and experts, and we will also talk about breast cancer treatment in both the public and private healthcare systems here in Catalonia. And today I'm joined by Oriol Escudé. Welcome back, Oriol.
Hello, Lea. It's great to be here. How are you?
I'm very good. Happy to celebrate the episode 200 with you.
Yay, we made it.
We made it. And I think it's also very appropriate to talk about such an important topic for our 200th episode. So let's get to it. So, as I just said now, October 19th is the World Health Organization's International Day Against Breast Cancer. And the purpose of the day is to raise awareness and promote people's access to timely control, diagnoses, and treatment. So, I think we all know what breast cancer is, but what are some of the causes or some of the most common risk factors?
Well, there's no one clear factor. In fact, doctors are not sure what causes breast cancer, but they know some things increase the risk. It's important to remember as well that having risk factors doesn't mean you'll get breast cancer, and not all risks have the same impact. As well, most women have some risk, but most don't get the disease. Now, let's get to the risks. Age and gender, those are the main factors. Most cases are found in women over 50 years old.
Okay, and what about genetics? Because as I understand it, if you have cancer in your family, you are more likely to get it as well. Is that right?
Yeah, it's another risk factor, but having a family history of breast cancer doesn't mean you'll get it too. But yes, it does imply some more risk as someone who doesn't have a family history.
And what else?
Well, these risk factors, age, gender, genetics, can't be changed. There are others like lack of exercise, smoking, diet, let's say lifestyle risk factors are also important. Again, they are not the main thing. So not having a healthy lifestyle doesn't mean you'll get breast cancer as well. But again, they increase the risk, and these are the only ones that can be changed.
And when we talk about breast cancer, most of the time we talk about women, but men can also get it, right?
Yeah, in fact, there are a few myths surrounding breast cancer that are false. And one of them is that men can't get breast cancer. They do. However, it's very rare. Only 1% of the cases of breast cancer are in men.
Yeah, I was really surprised that men could actually also get breast cancer. I mean, of course they can, but it's just not something that you really think about. And then when we talk about other myths.
Yeah, so one of the most common misconceptions is that if you don't have a family history of breast cancer, you won't get it. As we just said, most people diagnosed with breast cancer have no family history. Just about 5 to 10% of breast cancers are believed to be hereditary. So yeah, that's another myth about breast cancer. That's another one that is pretty famous as well. It's that wearing a bra can cause breast cancer. That's false as well. There's no evidence of that.
That's one that I've heard a million times.
And then that breast cancer always causes a lump you can feel. Now we'll talk about self-exams later, but no, that's false. You might have or not have a lump, and you might feel it or not. Especially when it first develops, it's easy to miss it.
And also a lump doesn't necessarily have to be cancerous.
Exactly.
And what about the numbers? Because I mentioned before that over 5,000 people got diagnosed with breast cancer in Catalonia last year. And worldwide, it's the most frequently diagnosed type of cancer in women and the second most diagnosed overall. What more can you tell me?
Well, I think it's important to know that even though it's one of the most diagnosed cancers, it's also one with the highest survival rates. These rates have improved over the years a lot, particularly in higher income countries like Spain. There's more awareness, early detection, and research funding. And even when it can't be cured, there are treatments that can extend life.
Okay, so higher survival rates, that's great news. And what are these exactly?
So last year in Catalonia, the 5-year survival rate for women was 89%, which is a lot. And this is great news, but of course, these figures only account for the 5 years after the cancer was diagnosed. Sadly, over 1,000 women died of breast cancer in 2022 in Catalonia. Now, this figure is a bit alarming. We have to consider that mortality rates are slowly being reduced. In fact, since the 80s in developed countries, it has been reduced by 40%.
Wow.
So hopefully in the next decades, we'll reduce that a lot
Even
more.
further. Let's hope the numbers continue to go down. And we don't only want to talk about numbers and stats, we also want to hear from survivors. So let's have a listen.
Al moment de la notícia, doncs, va ser...
When I got the news, it was like a bucket of cold water. Suddenly your whole world falls apart in an instant.
Mònica Roldán was 26 years old when she was diagnosed with breast cancer. It was the last thing she expected when she went to the doctor after feeling a lump on her breast.
Vaig anar al metge.
I went to the doctor, pretty sure it was a lump of fat or something, because it's not normal to have breast cancer at that age. They tested me and saw that it was a malignant tumor and that it had spread quite a bit.
Mònica is now 37 and her illness feels like a long time ago, although she says this chapter of her life will never truly close.
A nivell de família, a nivell d'amics...
Family, friends, none of us believed it. Until things started to get better, you think that you're going to die because that's the first word that comes to mind. Cancer, death.
When doctors analyzed the tumor, they confirmed that it had affected the lymph nodes, but had not spread and had a good prognosis. Mònica underwent 6 months of chemotherapy and a mastectomy. She then had radiotherapy. Family and friends were key throughout the process.
Hi havia estones que ho passaven ells pitjor que jo.
There were times when they had a harder time than I did, because I was in control of what was happening, how I was feeling, the pain I was feeling. But they didn't know how I was, and they wanted to help me.
Therapy was also a great help for her.
El vaig demanar perquè hi havia...
I asked for therapy because there were really difficult situations to deal with. Just like nobody teaches you how to be a mother, nobody teaches you how to go through something like this.
Another survivor, Grindel Darwich, was diagnosed with breast cancer at the age of 41 when she was expecting her second child. It was March 2020, just days before society was to be shut down by COVID-19.
Cuando a mí ya me sientan y me dicen que tengo cáncer.
The moment you're told that you have breast cancer is different for everyone, and I dealt with it very calmly until I was told everything about my son, that I would not be able to breastfeed him, that he would have to spend a lot of time in intensive care. I think that is what broke me, more than the disease itself.
Grindel had stage 2 cancer, and because of her pregnancy, she was induced to go into labor at 34 weeks so she could begin her treatment as soon as possible. On March 11th, her child Diego was born by C-section. She underwent 16 weeks of chemotherapy, then they eradicated her tumor and did radiotherapy.
Una vez que conocí a la asociación.
Getting to know the Spanish Association Against Cancer marked a before and after in my life. I received psychological support, of course, over the phone because of COVID, but it was essential.
Just as Grindel found support through associations during her treatment, Anna, who was diagnosed with metastatic breast cancer at the age of 29, found her own way of coping by organizing concerts on her terrace and raising awareness through her initiative, Radio Pati.
My friend Elias told me before surgery, "Hey Anna, we could organize some concerts in your house while you undergo radiotherapy. Something small, 10 people." I said, "Okay Elias, the idea is really cool. We always loved going to concerts, but right now I'm focused on the operation."
After the successful surgery, they returned to the idea. Since Anna would have to spend the entire summer at home for treatment, they planned to organize concerts while she underwent radiotherapy. What started as a small initiative soon grew into something much bigger. They attracted some of the biggest names in the Catalan music scene, such as Carlota Flaner, Lenais, and Mujeres, and the project quickly reached the public.
Era que les entrades fossin donatius.
We wanted all tickets to be donated to a cancer charity or foundation. Before the first concert, we had already raised 5,000 euros. All the concerts were almost sold out, so we raised the goal to 10,000 euros. We reached the goal before the last concert. When the campaign ended, we had raised a total of 13,270 euros.
After 3 weeks of concerts with 16 artists performing on her patio, Anna finished her radiotherapy and Radio Pati came to an end. The initiative not only helped raise funds and awareness for metastatic cancer, but also gave Anna the support she needed to better cope with the challenges of her treatment.
Radio Pati ha servit per...
Radio Pati helped me to stay active during these months, both mentally by organizing and producing, and emotionally by being surrounded by my friends and family, all working together on this project. It gave me a lot of positive distractions and helped me forget about the hospital for a while.
Other campaigns include one organized by the association Ginkgo. For the past 3 years, they have been trying to post photos of cancer survivors' bare breasts to normalize what these women go through, but neither Instagram nor Facebook allow it, as they consider it sexual content.
És a dir, no és una foto que és censurada simplement per ensenyar un pit.
Not only do they censor pictures of bare breasts, if you post a video showing how to do a breast self-exam, they censor that too. How can we normalize this situation if we can even see it?
Alba Martínez is the photographer behind the campaign, which consisted of posting photos of survivors with their breasts exposed, but covered by a sign that reads, "It's not sexual content, it's cancer."
Es la realidad de muchas mujeres que tenemos cáncer.
This is the reality for many women with cancer. My body is like this now, and no one has the right to censor it.
The president of the association, Aurora Fernàndez, also criticizes the fact that the portrayal of breast cancer in the media does not reflect reality.
El cáncer de mama.
The only pink thing about breast cancer is the ribbon. Everything else is incredibly tough. There are extremely dark moments, and what we need is for society to come together and offer support.
Thanks to everyone for sharing their story.
Yeah, it's not an easy one, and it's hard to share these stories and talk about this, but we really need to hear more about survivors, so thanks to everyone, it was really great.
Okay, let's talk about early detection, because this is one of the most important things for a better cancer prospect. And early detection means getting checkups and also doing self-exams. But there are different ways of going about this.
Yeah, and even experts do not agree on a few things. First, breast self-exams, which is when you check your breasts for lumps, changes, or abnormalities. There's not one universal method, but most guidelines recommend first visually checking the breasts, then feeling them using the fingers and moving in circular motions across the entire breast. First do it standing and then do it lying down. Now this is the general guideline of what a breast self-exam is.
I think all of us have seen videos about this. There are multiple resources out there.
And I thought this would be like something easy and great to do, to check up for lumps. But there's a lot of controversy about this because there's mixed evidence about if it's effective or not. Some experts say that these exams help women detect changes early, which leads to earlier diagnosis. But others say that these self-exams do not improve mortality rates. And in fact, they say that it might lead to unnecessary anxiety, false alarms, etc.
Because you can start obsessing about it and start finding things that aren't there.
Yeah.
So what should we do instead?
Well, we're not doctors, so check with your doctor as soon as you feel anything. But there are some medical organizations and experts who are now advocating for breast awareness. Now, what does this mean? Well, breast awareness encourages women to be familiar with their breasts, so it does imply some self-checkup, but not following a rigid self-exam routine as the traditional breast self-exams would imply.
That makes sense. And also, let's not forget that regular screenings like mammograms, they are the most reliable way to catch breast cancer early.
Yeah, no matter how many breast self-exams you do or a doctor does, cancer cannot be diagnosed with a self-exam or with someone else's exam. It cannot be diagnosed by touching it or by seeing the breast. Mammograms is the only test shown to reduce breast cancer deaths and the most reliable one for early detection.
But unfortunately, it's not available for everyone for free, because in Catalonia, it's only offered twice a year for women between the ages of 50 to 69.
Yeah, so last year in Catalonia, 430,000 women were invited for a mammogram and 65% of them participated. Now, through this program, they detected around 1,300 breast cancers that otherwise wouldn't probably be detected that early because it's women who haven't had no symptoms or no signs. So it's a great program, but there's a bit of controversy over the age limit. So now, as you said, the age for women invited to take mammogram every 2 years was 50 years old to 69 years old, but the EU actually recommends from 45 years old to 74 years old.
Okay, so basically starting earlier.
Exactly.
But if you're not in that age group, if you're younger or older and you want to get a mammogram, what do you do?
So if you're outside the recommended screening age in the public health system, only women at high risk due to family history can access mammograms, or of course if you have symptoms or signs. But without symptoms, it is likely that you won't have access to it, because first you have no symptoms and then they consider that you're not within the age that's more at risk of having it.
And I'm really interested in knowing that when a person gets diagnosed with cancer, what are the differences in treatment between the public healthcare system and the private one?
So Spain's public healthcare system is universal, so it's free for everyone who's a citizen. It's a high quality care system as well, and everything, including cancer treatments, is fully covered by it.
Okay, and what about the private system?
So many people in Catalonia have private health insurance, which is often provided through their employers, and some of them opt for a private system for cancer treatment.
Yeah, and although there's no data on the waiting times in the private system versus the public one, it is believed by many people that going through the private healthcare system offers quicker access to appointments, tests, and surgeries.
Yeah, but it's important to mention that in Catalonia, in the public system last year, 99% of cancer surgeries were done during the established waiting time frame, which is 45 to 60 days.
Okay, so everyone gets treatment whether they are in the private and the public system.
When they need it.
And we wanted to learn more about what it's like to treat cancer in the public system, so we talked to a group of doctors. Let's hear what they said.
Although the fight against cancer in Spain has come a long way in recent decades, there's still much to be done. Oncologists are pushing for one key demand, reducing the time it takes to introduce new medications into the public healthcare system.
When a drug is effective and is approved by the European Medicines Agency, we face a particular issue in Spain. After the approval, a negotiation begins between the central government and the pharmaceutical company over the drug's reimbursement. The drug is approved, but because it's very costly, we can't technically use it until the price is agreed. And during this negotiation period, patients are left waiting.
Dr. Antonio Llompart says these long waits prolong the suffering of patients. On average, new cancer treatments take 2 years from approval to actual use.
There should be a mechanism to ensure that patients don't lose the opportunity to benefit from these drugs due to the extended negotiation process. While it may not be necessary for every patient to receive the treatment immediately, we need to find a solution where, on a case-by-case basis, patients can access these drugs. Waiting 2 years can mean many of them won't survive.
Another major concern for oncologists is burnout. According to a study by the European Society for Medical Oncology, more than half of oncologists are affected by it, with 25% considering leaving the field altogether.
The first factor is urgency. Our patients can't wait, so no matter how many patients are scheduled, we make every effort to see them as soon as possible.
According to Dr. Elena Elez, urgency adds to the emotional burden, another key factor contributing to burnout.
We see some patients for years, patients in whom the cancer spreads, and we witness important moments in their lives. Some have become grandparents or got married, and younger patients, those with tumors, may have had children. All of this inevitably leads to emotional bonds.
Dr. Angela Lamarca shares this sentiment.
We have moments where we deliver great news, and that's wonderful. You often feel just as happy as the patient, but sadly, we also have to deliver a lot of bad news, which creates emotional stress.
Another source of burnout is the constant change in the field.
Oncology is a field that changes rapidly. I've experienced going to a conference on a Friday or returning on Monday and realizing that the treatment I was using before has already been updated. This constant need to stay on top of the latest developments adds stress for oncologists.
Thanks to everyone for speaking with us. So one thing that I think is really important to talk about when we talk about cancer and diagnoses is how to support someone who has cancer.
Yeah, exactly. I think when cancer comes, it's something that disrupts our lives completely, whether it's a friend, family member, whether it's ourselves. I unfortunately had this experience. My mom had breast cancer, and I remember the first reaction. It's a kind of mixed feeling between shock, sadness, anger, fear. There's a lot of fear. And I think everyone who's lived this closely relates to this. It's hard to process at the beginning. So when you experience all these things, remember that it's completely normal, whatever you're feeling, and take care of yourselves. That's another thing. And the people who is around you.
That's really good advice. And we have a few other tips that we would like to share with you.
Yeah, so if you know someone who's having cancer, I think these are really good advice. One of the first ones, it will be to be a good listener. You know, these feelings we're talking about, it's normal you feel them, but you have to understand that the person who has it feels them even more than you. So listen to them, let them express their feelings freely, and don't judge. Just be there for them.
Another thing that you can do is offer specific help, like practical things, right?
Yeah, you know, we usually do this thing where we say, oh, let me know if I can help with anything or if I can do anything. I would say just directly say, hey, can I drive you to your appointment? Can I cook for you? Can I help you do the groceries? So like offer specific and practical advice.
And then also just treat your friends or your loved ones as you always do.
Yeah, I think this works for any kind of illness or anything. There's no need to treat them differently just because they have cancer. So yeah, just do the things you used to do before. Chat with them about the things you used to chat before, and yeah, just treat them as you would.
And then in addition to that, respect their wishes and also their privacy.
Yeah, this is also very difficult sometimes to handle because everyone handles it different. Some people want to share information with other people, want to talk to you about the diagnosis, but some other people don't want to share anything or talk about it. So just respect it, and more importantly, let them decide who to tell and how much to share.
And one last tip, Oriol?
I'd say celebrate small victories because, cancer is a long road. So we have to celebrate every good test result or finishing a treatment cycle or whatever it is, celebrate it.
That's great advice. And it's time now for the Catalan phrase of the week. What is it this week, Oriol?
Well, it's a famous one. You might have heard it if you've heard the 200 episodes of Filling the Sink, because it's the one we used on the first episode. And it is de mica en mica
s'omple la pica.
Which means that little by little, the sink fills up.
And that's exactly where the name of the podcast comes from, because with every episode, you learn a little bit more about Catalonia.
It's a great name.
It really is.
And well, that's the meaning of the phrase, right? It means that, taking things one step at a time. And I think it's great advice for people going through cancer or with someone close to them that's going through it.
Exactly. That's all we have time for today. Thanks for listening. Make sure to subscribe to Filling the Sink wherever you get your podcast if you haven't already. Thanks to everyone who spoke with us. Thanks to you, Oriol. And the podcast will be back again next Saturday. But for now, this will be my last episode as I'm off on maternity leave. So I wish you all the best. Take care. Fins aviat. I adeu.